Well, good afternoon, everybody. This is Brian Hastings with the University of Nebraska Foundation, and on behalf of our Foundation Board of Directors and our board chair, Bill Jackman in Dallas, Texas, who's joining us today, as well as our chair-elect, Don Volte from Omaha. It is our privilege to welcome you to this special briefing on the novel coronavirus pandemic featuring our own UNMC Chancellor, Jeffrey Gold. Also joining us today is University of Nebraska System President Ted Carter, who you will have a chance to hear from in just a moment. But I want to just start off and say that we really appreciate that so many of our foundation trustees and Giving Society members could take the time to join us this afternoon. And we're pleased to be able to, thanks to the joys of technology, have a chance to bring this very special briefing and opportunity to all of you who support the University of Nebraska and help it be the leader that it is, especially in situations particularly like this one. Obviously, these are unique times, and for the safety and health and well-being of all of our students, employees, and communities, we have kept those thoughts at the forefront of all the decisions that we've made at the university and the foundation here in the last few days and week regarding this situation. And for our trustees and Giving Society members, I thought it would be good for you to know some of the steps that we've taken at the foundation just to start off here. We have tried to approach this in a very proactive way ourselves, obviously keeping in close contact with the university and leveraging all of their knowledge and expertise and decisions in concert with them. But over the last week, we mobilized all of our staff with the capability to work remotely. They've been doing that this week from the comfort of their homes. We have suspended all of our staff travel and all of our events and all of our personal appointments and meetings for the time being until we get through this particular situation. And again, trying to embrace new technologies and new opportunities to find different ways to keep in touch with all of you and our other benefactors. We obviously don't know what the future holds for us right now, but we're trying to anticipate all of those different scenarios and find all of the innovative ways that we can continue to do our important work to grow relationships and resources that enable the university to change lives and save lives. We take that mission very seriously and passionately, and it's something we want to continue to enhance as we move forward. I'm actually participating from home today myself, where I'm working remotely and self-monitoring after being on the road last week, both for personal and business travel and going through about 3 different airports and being at a ski resort. So I'm at home today. We have Ted Carter, our president, participating from Varner Hall in Lincoln, and Chancellor Gold on the campus of the University of Nebraska Medical Center. I just want to mention maybe a couple of quick logistical things here as we start off. Everybody who's joined us as an attendee or as a participant will likely be muted just because having hundreds or thousands of people talking at one time obviously becomes a little bit of a challenge, but there is a Q&A feature and a chat feature for those of you who were able to join us via video. If you can use the Q&A for any questions that you'd like to pose, we can try to use those later on to supplement our questions that we received ahead of time. And what we'll do is we'll have Ted Carter share some news and insights with you, and then turn it over to Chancellor Gold for really a briefing on the situation and for him a chance to share some of his expertise and insights. And then at the end of our session, we'll facilitate some Q&A with both Chancellor Gold and President Carter. So at this point, I'd like to introduce you to the 8th president of the University of Nebraska System. Ted joined us officially in January after spending the last 5 years as the superintendent at the U.S. Naval Academy. Also, after completing a decorated career of 38 years in the U.S. Navy and as a retired vice admiral. Along with the chancellors, Ted and the university leadership has really done an outstanding job of navigating the university and all 4 of its campuses into and through this situation up to this point. And certainly with Ted's career, he's not had a shortage of challenges in leadership and challenges in dealing with challenging situations. And we're fortunate to have him at the helm. So at this time, I know not all of you have had a chance to meet him personally. Many of you have had a chance to meet him, but probably not everybody. I'd like to introduce President Carter.
Well, thank you, Brian, and good afternoon, good morning, wherever you're listening from. It's a real honor to be able to talk to the University of Nebraska Foundation, our trustees, as well as our Giving Society. I want to just say right up front, thank you for your time and your generosity, all the things that you do for our university. We would not be where we are in terms of our success without you. As Brian mentioned, I'm on the job now for about 3 months. And who could have ever predicted, where we would be today? Besides our featured guest speaker here, Jeff Gold has certainly been on the forefront of this. But I'll just share with you to give you a perspective of, some of the things that I've done in my past and how I view this right now. Because I've been asked this a number of times. Have I ever seen anything like this? I've been involved in a lot of different crises, and I've been involved in a lot of, high intensity operations in my life. I was second in command of an aircraft carrier during 9/11. I've led the first combat missions into Kuwait, Iraq, Bosnia, and Kosovo. I took a part of command that involved 7,000 people and their livelihood. And I'll share with you, even though I've been involved in some life and death situations, I've never seen anything of this magnitude, not just here for what it has impact across our university system, but in our state and our nation and the world. So this is a big deal. We have been very cautious and responsible in our decisions that we've made here for the university system. As you can imagine, the first thing that we have paid attention to is making sure that we're taking care of every individual, to include our leadership, our faculty, our staff, certainly our students, their families, and our communities. And that's in every decision that has driven us to make sure that not only how we best take care of them, but how we continue on with the mission. And that was a decision that we made about 2 weeks ago to go to a complete remote education program. The good news is our IT systems through applications like Zoom and Canvas and others have set us up to be successful there. I feel very confident, especially given the talent of our faculty and our staff, that we'll be able to carry on that mission and deliver everything from undergraduate to PhD programs, and continue to make doctors and nurses and architects and lawyers and all the things that we do here. The third thing that we've tried to make sure that we're doing is not to disadvantage anybody. In other words, our hourly workers, our student employees, our adjuncts, of course, our faculty and staff. And that's no easy task. We promoted 80 hours of emergency leave for those that were directly affected by this infectious disease, so to allow people to get home and take care of some things. And of course, starting Monday, everyone will be wherever possible working remotely. So those are just some of the things that we've been doing, but make no question, as you look across all 4 of our campuses, a campus that's been front and center across the national discourse on this topic from the very beginning is what Dr. Jeff Gold does in leading the University of Nebraska Medical Center. I'm proud to be a partner with this part of our organization. Dr. Gold was the very first question I took in my interview process, and there's nobody that I'd rather be partnered with to lead. If we were to think about this in a military operation, Jeff is the field marshal that you want leading in how we're going to solve this pandemic. So I'll turn the stage over to him and let him do what he's been doing a lot, and is briefing the experts from the White House to our students, to our staff, and now all of you. So Dr. Jeff Gold.
Well, thank you, President Carter, and thank you, Brian, for the introduction. And also, it's an opportunity for me to thank all the members of our foundation, and the donors and the philanthropists and the giving societies that make this campus so great, that empower the energy to do the kinds of things that we do. So I thought over the next several minutes before taking your questions, I would do a couple of maybe 3 things. One is try to set the stage of where we are now and some of the predictive models of where we might be going as a country, and share with you some of the best thinking on that we're accessing. Secondly, to tell you what the role has been for the University of Nebraska Medical Center and Nebraska Medicine. And then thirdly, share with you the advice that I would give to a family member or a friend who was saying, well, what does this mean to me? What does it mean to my business, to my children, to my parents, etc.? And then try to use that as an opportunity to springboard into any questions that you might have. I should preface this by telling you, for those that you don't know, I'm a recovering cardiac surgeon. I am not an infectious diseases expert or a public health official, but I have had the opportunity to work very closely with these individuals and have learned a good deal from them and try to share the very best knowledge. And on that point, we only share information here at the Med Center that is scientifically based, and we do it in a timely and transparent way, which has been critically important to the credibility that we have enjoyed on every possible level. And indeed, as President Carter said, we have the opportunity to work very closely with the very highest levels of the federal agencies, the White House, etc. I mean, a day doesn't go by that I'm not on the phone with Washington 2 or 3 times a day, and as is the leadership of the organization that I'm so thrilled to work with. But let me set the stage a little bit for you. For those of you that probably don't track this day to day and hour to hour, as of 7 o'clock this morning, we've exceeded 246,000 confirmed cases of COVID-19 worldwide, with just over 10,000 deaths in total. That is an astounding number, but it's even more astounding when you realize that only 1 in 20 cases ever gets reported, ever gets tested, ever gets known. So if this is really the case, that we're in 250,000, that means there are probably 5 million cases worldwide today. However, of those that are tested and recorded as confirmed cases, we went up over 30,000 worldwide in the last 24 hours. We have been going up at about 15 to 20,000 per day in the last week. So this is a 50% jump in the increase. Now that may be due to better reporting. It may be due to better testing. It may be due to catch up in the data. But that is an astounding number. As of 700 hours this morning, we were at 14,250 confirmed cases in the United States with 205 deaths involving 50 out of 50 states. It is also worth knowing that of the 205 deaths that we've now recorded as of this morning, 54 of them were in the last 24 hours. And so it just continues to underscore the fact that there's quite a bit of high impact. And we'll talk about why that is in another minute. And then finally, there were, as of 7 o'clock this morning, Central Time, there were just over 5,700 confirmed cases in New York City. That's obviously a part of the country I care a lot about because that's where I have family. A week ago, Saturday, this last Saturday, there were 554 confirmed cases in New York. And if you will do the math, that's more than a 10-fold increase in 5 days, an astounding ramification. And New York City is an area with very sophisticated healthcare systems that openly and transparently report through their health departments. So there's no reason to doubt the validity of that data. Indeed, many would say it's underreported. Just for purposes of comparison, I actually, for another meeting earlier today, I pulled the data from 1 month ago, February 20th, 2020. So on that day, a month ago, there were just over 82,000 confirmed cases, of which 81,000 were in China. There were 1,026 cases outside of China. To do the math today is that 60% of the confirmed cases in the world are not in China. At that time, there were 26 countries reporting 1 case. Now there are 163. And so the ramifications of this have been dramatic. And if you look at the outcomes that are being now reported from Italy, from France, from Germany, from the United Kingdom, etc., you're seeing the rapid spread of not only confirmed cases, but hospitalizations and unfortunately critical care needs, and even more tragically than that, deaths. So we understand now from not only data from China and from Western Europe and other parts of the world, but from our own research here at the Med Center, research that's coming out of Washington State, California, New York, and other parts of the country, a lot about the risk factors of this disease. So I should tell you that this is a virus. It's a typical RNA zoonotic virus, which meant that it's lived in the wild, probably in bat caves for decades. And then because of a genetic shift that occurred sometime early fall last year, it shifted genetically sufficiently so that it could infect mammals. And once it went from mammals, it went to primates, and from primates to humans through the live food markets in China. And then the story began to be told in Wuhan, then throughout Hubei province, and then through all of China, the Far East, the Middle East, Western Europe, and the United States. We know that, that individuals who are older are more likely not to become infected only, but to have the complications of that infection. Because we live in a so-called immunologically naive society, that is to say, unlike measles and other diseases where many of us have active immunity, none of us have seen this virus before. And so our ability to immunologically fight it in the absence of a vaccine is literally zero. And so it is possible that anybody can become infected with this virus unless they've been exposed to it previously. As a result of that, it became necessary and very useful to do some public health monitoring as to who's at risk for infection, who's at risk for hospitalization, who's at risk for needing intensive care, and then what can we possibly do to blunt that spread of the virus. Because there is no question, no matter how you do the math, that unless we can slow the spread, we are going to continually exceed the capabilities of our healthcare system in the United States, which is exactly what's happened in many other parts of the world. It certainly happened in Wuhan. It certainly is going on in Italy and in parts of Western Europe, and tragically is going on in New York, in California, in Washington State, and elsewhere. So the current modeling shows that for individuals below the age of 15 years, the hospitalization rates and indeed the mortality rates are extremely low. Below 9 years of age, they're almost reportable, other than for children with immunologic diseases. However, in the 70 to 80 age range, the mortality rates are about 15%, and the hospitalization rates are much higher than that. In the over 80 age groups, the mortality rates are estimated to be approximately 25%. That means 1 out of every 4 individuals that has been identified can unfortunately need not only hospitalization and intensive care, but likely pass away as a result of this infection. The comorbidities are also very important because we know that things like diabetes, heart disease, lung disease, those patients who are on immunosuppressive therapy, patients being treated for cancer, are also at particularly high risk of the need for hospitalization, critical care, ventilator support, and unfortunately of passing away. So there were 4 models that were proposed by the Centers for Disease Control and Prevention that were published and distributed last week. They're affectionately known as models A, B, C, and D, A being the most conservative model, D being the most significant and most aggressive spread model, modeling what might happen in the United States. So just to give you an idea, model A, the least aggressive and most conservative, would be that 20 to 25% of all American citizens would become infected. That would be about 75 million, by the way, if you're doing the math. Model D would be 265 million American citizens would become infected. And if you're doing the math, that's about 65 to 70%. Of course, these numbers all come from a situation which is unmediated, where there's no aggressive intervention and that the communities do not implement the so-called non-pharmacologic interventions, the NPIs, that I'm going to talk about in just a few minutes. But if you then look at the other aspects of this, how contagious this is, what the doubling times are, what the average percentage of hospitalization is, and this is estimated to be all in 5%, what the average need for intensive care is, which is estimated to be 2%, and what the average mortality rates are, which are estimated very conservatively to be 0.5%. You can then apply those numbers in this most conservative model to the country, to a state, or to a city. So let's look at it for the US for a minute. In the most conservative models that we've worked with, it looks like approximately 96 million to 100 million infections, 5 million hospitalizations, 2 to 2.5 million intensive care unit admissions, just over 1 million patients needed to be placed on a ventilator, and a case fatality rate of just under 500,000 individuals over the next 3 to 4 months. Now, again, this is without extreme non-pharmacologic interventions being put into place, similar to what the governor of California did and the governor of Nebraska has done, and several others. Those are pretty conservative estimates, believe it or not. If you put that to the state of Nebraska, you're talking about between 600 and 650,000 infections, tons of 5% of those, that's 30,000 admissions to hospitals. That would be roughly 12,000 ICU admissions, and somewhere between 2,500 and 3,000 deaths over the ensuing months. And that assumes that we have access to testing, that we don't run out of personal protective equipment, and that we have a full healthcare professions workforce. If you do the math on a national level, that would be 6 times every acute care hospital bed in the United States and 10 times the number of ventilators that are available in the United States. Which is why, as what you see going on in Italy right now, is that they are literally making life and death decisions based upon age and comorbidity as to who gets admitted to a hospital, who gets put into an intensive care unit, and who gets to have a ventilator. And so the answer to this, and that is why you're seeing such extreme responses across the United States to the non-pharmacologic interventions, is to try to, quote, flatten the curve. And for those of you that haven't heard that phrase, I recommend you go online and look at it. But what it basically means, what we're trying to do is, instead of having a curve that peaks really high and then goes down quickly in a period of weeks to months, what we'd like to do is flatten that curve out so it goes 9 to 12 months, getting us to a period of time where we might have an effective vaccine, but most importantly, to not deplete the facilities, the workforce, and the supply chain necessary to run our health systems. And so all of the work that we have been doing here at UNMC and Nebraska Medicine, and the work that our partnership has been with the health departments, the federal government, et cetera, has been about trying to shore up supplies and equipment, make sure we have adequate and accurate testing, and then to also spread the word about the importance of these NPIs. Now, shifting gears for a second, as you probably know, going back almost 15 years now, UNMC and Nebraska Medicine have been very active in the area of biocontainment, quarantine, and isolation, and have become a trusted federal partner, state partner, regional partner, with multiple leadership roles through the National Ebola Education and Training Center. As you may not know or do know, that we are the National Center for Health Security, designated by the federal government. We operate the only federally authorized quarantine and isolation unit in the United States. Currently, we are federally funded for training of the entire NDMS, the National Disaster Medical Service Corps, and many, many other responsibilities that we have as thought leaders. And by the way, none of that includes me, to be really clear. It includes the people that we have part of the Global Center for Health Security. We've also been very helpful in providing critical, important laboratory work. Not only are we the first testing site for some of the new agents that have been involved in this outbreak, but we also were the first institution to identify the fact, excuse me, that the early test kits that were released from the CDC were not accurately reporting the results. And by the way, in case you're wondering, anybody, this is what a test kit actually looks like. It's a little tiny box like this, And let me tell you, these are in rather high demand across the United States right now. But our researchers identified the fact that the first test kits were not fully functional. We helped them change the reagents. And now what the CDC is distributing, which has been licensed to several commercial vendors, are the formulations, frankly, that our research scientists here at the Med Center have come up with. And so we are front and center and spend a good deal of time sharing information, listening to others, learning from others. And I will tell you that I am incredibly honored to be part of an organization that has been catapulted yet once more into the national spotlight. There is no national media outlet that has not either been here or is in the process of working with us across the nation. And everybody from Fox News, we have a large piece on 60 Minutes on Sunday. We've done CNN repetitively. We had a huge piece in the New York Times and Politico. It just goes on and on and on. As a matter of fact, we made a strategic decision just earlier this week that we're going to stop all campus visits from the media after 6 individuals from one of the major national media outlets who fortunately were not here as part of the visit team and the filming crew, but were elsewhere in the country, were diagnosed with COVID-19. And just as to protect our own group, so we are using video uplinks and other means of communication to produce content without actually hosting individuals or traveling ourselves to other parts of the country. So with that, Brian, what I'd like to do is just briefly shift to the advice that I give family and friends, if I may, and those are the core of the non-pharmacologic interventions. And we can share all this in writing, but I also recommend that you can go straight to the CDC website, you can go to our website, you can go to the local public health department websites, because the information does change constantly, but this is where we are today. And so this is what I would say. If you are sick or you think you're sick, stay home. If you have an immediate family member who is sick that you've been in contact with, stay home. If you are concerned about whether or not you've been exposed to somebody who has this disease, don't get in the car and drive off to your nearest healthcare professional, urgent care center, pharmacy, doctor's office, or local emergency room, because the overwhelming majority of the time you will not have this disease. However, if you sit in a waiting room with 11 other people who do, I can assure you what's going to happen at the end of that 20 minutes or 30 minutes that you're going to be sitting there, and it isn't going to be pretty. So if you think that you may have the disease, if you have fever, chills, shortness of breath, pain or tightness in your chest, any of the signs that have been so widely described, please call your local health professional, go to the CDC website, go to our website, get online, do what you need to do to get advice. Patients who are at high risk, patients who have had a travel history, patients who have had a direct exposure do need to be tested. And the healthcare professionals will give you information as to exactly where you need to go and what you need to do to get your testing. Home hygiene is absolutely critical. And by that, I mean, it's not just hand washing, but it's surfaces, doorknobs, etc. We know that the viruses can survive on surfaces for long periods of time, meaning hours and in some instances days. So it's not just whether you clean the doorknob of your local business or your church or your home care organization, but it's how often you do it, and it's trying to maintain appropriate social distancing, meaning 6 feet. The number 10 individuals, you know, as I say very often, 10 individuals in my office is very different than 10 individuals at Memorial Stadium, and we need to have some common sense about that. We're very much focused on childcare right now, and it's not that children are subject, as I said earlier, to hospitalization and to the infection, but much more importantly, it's that our children are the vectors of this disease in many instances, because they're so young and they're otherwise frequently got a cold or a runny nose, particularly in the winter, and so they spread this disease and they may not even know they have it. And you know, when we get into these childcare needs, particularly as K-12 schools are closing and daycares are closing, the usual instinct is, you know, get on the phone and call grandma and grandpa and they'll come and take care of the kids so that you can go to work. But in this particular instance, that is exactly the wrong thing to do. So getting into community sharing groups and trying to spread the childcare needs out is particularly important, particularly as it relates to freeing up healthcare professionals to go to work. There are many communities in the country now, particularly in Northern California and in New York State, that I've been talking to, where as much as 30% of the healthcare workforce are calling off on a daily basis, not only because they're ill or they're in quarantine, but because they can't get childcare and their kids are out of school and there's no other option for them. So that's a very important consideration. And then finally, I would say that if you have questions or concerns, make sure you stay connected to trusted sources of information. There's a ton of stuff going on the internet. There's a ton of stuff going on through social media that is blatantly misleading. Some of it is intentionally misleading. Fictitious charities, cybersecurity breaches. I mean, it's just endless as to, in spite of the fact the overwhelming majority of the community is trying to do the right thing, there are always a small number of individuals who are trying to take advantage of every situation, and that produces a lot of stress and a lot of uncertainty. So in closing, I would say if you have questions, please feel free to reach out to us, to reach out to me at any time. We will do our best. I do spend a lot of time trying to quash rumors. I will tell you, I am so privileged to work with President Carter and my fellow chancellors and the leadership of our campuses. The proactive, thoughtful, we've been preparing for this going back to almost your first day, Ted, and it's been so effective to have all of these operational plans in place to just sort of go step by step and phase by phase in a measured way. And we hope to be able to transmit that type of security and that type of message to the broader community. You know, as I said to my grandchildren by FaceTime on Sunday, my grandchildren are 3.5 years old, twins, a little boy and a little girl. You know, I talked to them a little bit about the germ theory, about good germs and bad germs, but what they wanted to know is why they couldn't go to school, and they wanted to know why they couldn't have play dates and why the library was closed. And we talked about it for a while, and I finally ended up saying to them, you know, what you really need to know is how much we love you and that we're going to do everything to protect you, and that, you know, we're going to get through this. I don't know how long it's going to take. There's no way to know, but everybody's got your best interests, and we're all in this together. And I think that's the message we share with the broader community. And at the end of the conversation, my grandson said, you know, Grandpa, it's okay. And I felt really touched by that. So Brian, I'm open to questions.
Great. Well, thank you, Chancellor Gold and President Carter. I'm going to start with some of the questions that came in submitted to us ahead of time. So first one for you, President Carter, what concerns you the most about this pandemic, both right now in the near term and from the long-term perspective as president of the university system?
So certainly the most immediate concern is make sure we're doing everything we can to take care of our students, our faculty, our staff, their families. As I mentioned, the community. I didn't mention it before, and I know Jeff touched on just how many different organizations we touch through our university system. I mean, you think about 375,000 graduates through our through our campuses, but you know, from the governor's office to all of the superintendents of schools, to the mayors at Omaha, Lincoln, to our state college system, our community colleges, just about every constituent, every walk of life here in Nebraska has been coordinating with us, not just because, as everybody heard, Jeff is the national expert on this, but they're looking to us to make reasonable and thoughtful decisions about where we're going to go. When the governor does a press conference, Jeff is often there, and he has had me there as well, and he speaks to me quite often. So we're trying to make sure that we're taking care of the immediate short-term need of taking care of the health and welfare of everyone that is directly associated with us, particularly our students. At the mid and longer range, I want to make sure that we keep the faith with our students. Obviously, for those that are graduating, we want to make sure that we get them to the end of their semester, to their diploma ceremony, commencement exercises, whether they happen live or virtually, thinking through the next wave of students who are scheduled to come to us in the fall and the summer. Obviously our campuses are open, but we're not doing tours. We're just maintaining the dorms for the students who actually have no place else to go but live there, and make sure we're taking care of the security of our campuses. So how do we keep our doors open to welcome the future students for our campuses? If I have a concern, I'm worried about what % of enrollment will go down because either students choose to not do online education if we're still in that space of the summer and the fall. Obviously, our big attraction is our in-residence programs, getting the full campus experience. So this isn't a Nebraska problem, this is nationwide. The face of higher ed is going to change after we go through all this. Those that can do the online and virtual distance education well, do it correctly, will not only be winners, but will probably gather more students that way. So we're trying to make sure that we're doing everything we can to get that part right. I've been very impressed by how our faculty have stood up to get this right. Programs like what Jeff leads at the Med Center, he's already got a full class load coming in the fall, and he'll continue to track. But from our larger programs, whether it be Kearney or Omaha or Lincoln, certainly our international students, I can expect to see a dip in those students. And those that may choose, instead of becoming a freshman, may take a gap year until this thing kind of settles through. So how we deal with that economically through our reputation, we still got a little bit of work to do. And that's what I'm working on with the team. So we're paying attention to everything.
Great. Thank you, Ted. Chancellor Gold, a number of questions, a hot topic, and you touched on this a little bit in your remarks with regards to some of the testing availability. Where do you feel we are as a nation or as a community in Omaha or as a state of Nebraska on getting the desired level of testing deployed? And how long will that take?
Well, we are currently not at maximal capacity in the state of Nebraska. It may not be known to this audience, but that UNMC actually operates the state public health testing lab. We also were the third institution in the United States to get our own testing lab separate from the state lab operational with our own test equipment and test methodology. And so we are able to meet the need at least as of my 8 a.m. briefing this morning. However, having said that, as the numbers continue to expand, and I speak to my colleagues in New York, I speak to my colleagues in California and Washington State and elsewhere every day on a briefing I have mid-afternoon, just to try to make sure we're all, nationally connected on this, is we may run out of testing equipment. And indeed, we may reach a point that testing becomes irrelevant. We're just going to treat people symptomatically. There are other methods that we have to confirm what's going on. I'll give you one example. Normally this time of year, you see influenza reporting start to fall. Indeed, flu season is always in the winter. You see a rise, then you see it sort of plateau, and then it dips, etc. So interestingly, what we're seeing this year across the country is we're seeing the flu rates go up, and they've been plateaued, and they have not really started to fall. But what has started to fall is the actual flu test positivity. So the ILI, the influenza-like illnesses, are flat, and the number that are actually testing positive for flu are falling. And so we're watching that, which is a pretty good indication to us about how much COVID there actually is out in the community now. And we have this broken down by zip code, by city, etc. So I'm very confident that the availability of test kits will go up through the private sector that's manufacturing them now. We are actually developing a newer test here, which is going to be really important because current testing not only measures living and infectious virus, but it measures dead virus as well. So we'd much rather have dead virus than live virus, right? Because that's a really critically important question, particularly as it relates to hospitalization. Because right now, we will not release anybody from the biocontainment unit or from the quarantine unit who has not had 3 consecutive negative tests. But all we're testing for is presence or absence of lead, live, or dead virus. Now, people who are carrying dead virus for days or maybe weeks don't need to be in a hospital or in a containment unit. and they certainly don't need to be at home. They can go back to work. They can take care of others. They can go to school. They can do anything they need and want to do. So being able to have a sharp determination of when that virus load is no longer viable is going to be really key. So we've been working very hard, and actually just this week announced the first so-called in vitro vital test that determines viability from non-viability of virus, which we hope can start to be scaled widely across the United States and around the world. A very important contribution by our Med Center.
Great. Chancellor, maybe I'll, in the interest of time, combine these next two.
Sure.
When do you think we might reach the peak of this illness in the United States? And two, what is the realistic expectation in terms of when a vaccine will be available?
So I'll answer the second question first because it's easier. There are a number of pharmaceutical companies developing vaccines both here and around the world. There's healthy competition. The first clinical safety trials, not efficacy trials, but safety trials actually started this week in the United States. We're actively involved in that. According to Dr. Fauci, Tony Fauci from the NIH, he believes the earliest scalability is going to be 12 months. Many people think it's going to be 16 to 18. I'm going to bet on 9 to 12, actually, but it's not going to be tomorrow to have a safe, effective vaccine. I might also add there are a number of drug trials that are ongoing. We are actively taking care of several of those ourselves with new drug being developed. That actually will probably hit scalability before the vaccines are available. As to when it's going to peak, Brian, without mediation, it's probably going to peak in between 2 and 4 months. So when I talk with the governor and the governor talks to school districts and others, we're talking 6 to 8 weeks. Certainly through the end of the semester is what we're planning from an academic perspective. But if we can flatten that curve and spread this out, it would be really great to get it down to the point that we can get it to next October, November, or December, perhaps. It may not lower the total number of infections, but it'll certainly protect access to healthcare.
So a question that came in just shortly before we started today. Now that the state of California has requested all residents to stay home, should Nebraska residents be considering the same? The comment here that goes with it is that it seems it's the only way to really expedite the end of the virus spread.
It's a discussion we have with the governor's office, the mayor, public health people every day as to what are the triggers. And the best triggers that we're looking at right now is the total number of infections that we can confirm in the state and the so-called community-acquired spread rate. And by that we mean, you know, if we can trace an infection, somebody comes back from Europe, they get infected, their spouse then gets infected, then one of their kids get infected. That's called traceable infection or traceable virus transmission. That's not the most important determinant. The most important determinant is when somebody that's had no known exposure to anybody that can be traced comes down with confirmed case of virus. So the threshold we used for recommending school closure and other things was 2 community-acquired cases, and we have crossed that threshold. We actually know there are about 1,000 people in Nebraska now that are in home isolation and quarantine who are not infected but were exposed. But as those numbers start to rise, that is going to be the determination of when the next steps are going to be taken. The mayor has taken certain steps, the governor has taken certain steps, and there are several steps that are outlined that have not yet been taken. You know, I will say this, unlike other parts of the country and maybe other parts of the world, there is tight communication at all levels between the university, the governor's office, the mayors, the public health officials, and we are lockstep communicating thus far, which is only going to help us as we move forward. You know, I just reflect for just a second when we were about to take the first Ebola virus disease case from Western Africa 6 years ago. And I remember Phil Smith and I went down to meet with was then Governor Heineman. And the question was, what should we do? How can we best prepare? What are the risks of doing this? And And finally, Governor said, you know, folks, you tell us what's scientifically sound and we'll follow. And that has been the entire thrust of everything, every decision that we have made thus far. And I'm so proud to be able to say that.
Great. Chancellor Gold, what can we do to help our frontline medical and healthcare professionals, or at least to show our appreciation to them during this time?
Well, there are a lot of things, but I'll come back to the child care issue. If we have physicians, nurses, pharmacists, therapists, dietitians, even environmental service workers who work in healthcare organizations, anyone, you should offer childcare help, you should offer shopping, you should offer anything you can do to make sure that they have minimal risk of becoming infected themselves or exposed, and also that they can continue to go to work. Because at the end of the day, the commodities are not going to be how many beds we have, but it's going to be the workforce and the supply chain that's going to determine what is going to be the outcome of this. Above and beyond that, take care of yourselves. Anything that you can do for yourself and your family to lower the demand would be very helpful. And then at some time, we're going to have to, as we look forward, we are planning solidly post-pandemic right now as to what are the lessons learned, how can we be better prepared, how can we continue to lead not only the nation, but lead the world in this area. So I'll give you one example. The UNMC, the Association of American Medical Colleges, has now advised that all clinical students in medical schools across the United States be pulled off their rotations so that they can preserve the use of personal protective equipment for licensed physicians in the United States. So we have put together a 3-month learning program to teach pandemic preparedness and all hazard care online to all of these students. And then we're going to offer them a certificate, which will give them a unique credential that they probably couldn't get at any other institution in the United States. And so it's an idea of being creative as to ways that we can enhance the educational program as a result of all of the circumstances around us. We just need to stay focused on that.
So maybe I want to be respectful of your time. I know, Chancellor Gold, you've been on the phone and on the video quite a bit today in different settings and briefings with different groups. So we appreciate you taking the time. Maybe I'll just throw one final question out here before we wrap up. And I think this applies to both you and to President Carter. But one of our attendees today posted a question about having 2 sons attending the university right now. And what assurances do we have that course instructors and faculty have the appropriate training to deliver online instruction and make appropriate modifications to help the students succeed with reasonable expectations and corresponding grace?
You want to start, Ted, and I'll feed in from the UNO and Med Center perspective, if that would be okay.
Sure. Well, the first thing you should know is, we've been doing online education for quite a while. And for those faculty members that hadn't had that much experience, we've had about 2 weeks of preparation to go to all online education. The courseware doesn't always exactly translate to some of the other courseware that we've done. So there has to be a certain amount of innovation, but I can tell you that, from an accreditation perspective, from a delivery of quality education, from the faculty that have stepped up to do this mission, I could not be more proud. In fact, it's moments like this in a crisis where, necessity is truly the mother of invention, that we are going to take it to another level. And, we are nationally ranked in many of our online programs already. So I know that we will be able to take what is already a great delivery method with some new tools. I mean, just this program we're using right now, this video system, you can hold 5,000 people on this communication device at one time. So, we should not think that the technology is not there to be able to do this. As I said, this could change the future of how we do some of the education delivery products. Not that it'll ultimately take away from the experiential or being in person, but I want to be the university that gets this right. Will we get it right on the very first try across the board? Probably not, but we'll learn from that. I have seen everybody step up. They're honest, they're transparent about what works, what doesn't work, and we'll just keep getting better at this. So, and I know Jeff's got some even slightly different challenges when it comes to, medical education. And he's also got the perspective of being the Chancellor at UNO. So I'll let Jeff add to that.
Sure. Well, I would just echo what Ted said, is that we've been delivering online and remote education around the world for a very, very long time with top nationally ranked programs. UNO, for instance, is referred to as one of the most veteran and military-friendly programs in the country, in the top 10 every year. And that's based largely on what we do through distance learning and online. But having said that, we created a huge amount of instructional material for faculty members in every department, both at UNO and UNMC, who may not have had a lot of experience in doing remote education. And then we did a very unique thing. We actually stress tested it. So long before we had to actually pull the trigger, we stress tested the technology, we stress tested the curriculum content, the assessment modalities, which means testing and assessment of learning skills and knowledge. We're actively using virtual reality and simulation. So we've used the work we've done in the Davis Global Center to actually teach donning and doffing and personal protective equipment at the Med Center. Done a lot of work with our cybersecurity team at UNO. And so while there are certainly going to be exceptions to what we're going to do, and think about biology labs, chemistry labs, etc. A lot of it may look like Julia Child, making the very next best fondue or whatever. And by the way, I've always failed the fondue class, whatever that's worth to you. But I'd say we're on it. And to President Carter's comment, it's not going to be perfect, but it's going to continue to get better. And I do believe it's going to transform higher education. So my message to that questioner is, for your kids that are enrolled at UNL, we are committed to your kids as much as I am committed to my grandchildren. And we're on this journey, and we're going to do everything we can to get it right. And I'll just add one other thing, if I may, and that is that when I was in Washington last week, I had breakfast with one of the secretaries of the major agencies, Homeland Security as it was. And his parting words to me were, Jeff, if you guys can't get this right, nobody can. And that was both an incredible compliment, but as President Carter and I have discussed on numerous occasions, an awful lot of responsibility rests on our shoulders to get this right.
Well, Chancellor Gold and President Carter, thank you both for your time this afternoon, and special thanks to our trustees and benefactors for joining us here as well. We are, as I said earlier in the opening, we're very proud of the mission that we play to help grow relationships and resources to enable you at the university to change lives and save lives. And situations like this certainly bring that mission to the forefront. And certainly couldn't be prouder and more grateful also for the outstanding leadership that both of you and the other chancellors are providing during this period of time for our students and for our faculty. So we will intend to hopefully follow up with an email message to all of you with the ability to view this program again online. So for those of you who were only able to join us via phone today, you'll have a chance to see it. And for our donors and trustees who were not able to join us for this time, hopefully they'll have a chance to view it at their convenience later on as well. And so to close, we just want to extend our kindest greetings and best wishes for continued good health to all of you. And thank you for joining us this afternoon. We're grateful.
Thank you, Brian. Thank you.